Hey guys, it's Dr. Roughton. It's 4:32 on Tuesday, October 25. If you're watching this not in the Bustmob group, because I think they may chop it up a little bit later, you can always join Bustmob on Facebook if you go to bustmob.com. As you guys know, we try to do these pretty regularly. If you have a question, I appreciate you posting it in the Facebook post, but also as you're watching this, you can certainly put it here, and I will answer it to the best of my ability. So this was kind of last minute, and I'm sorry for that. I never know exactly if I'm going to be on time or not when I finish the operating room. One question I got was, can you do the muscle tightening above the belly button if you're having a mini tummy tuck? The answer is yes, but most surgeons don't do it. I know for sure that we do it here at Amelia Raleigh, and my assumption would be that both Dr. Paul and Dr. Fredman would also both do it at their Amelias. It's a beast. It's harder for the surgeon by a lot, but it can be done. And so the difference in a mini, sorry, I feel like I jumped kind of ahead on that question, and I should have just drawn out what I was talking about. So you'll be treated to yet another drawing of mine on the wipe-off board. This is you pre-surgery, right? A regular tummy tuck, the one that you see most people describing, I take off skin that looks like this. This top stuff moves down, okay, I take a picture of that stuff, and then you have a scar around your belly button and a scar from hip to hip, okay? What's a mini tummy tuck then? Well, a mini tummy tuck is typically for women that don't have a lot of extra skin. And so back to square one again, it's here and here. So less skin is taken off, and then we just pull this down, okay? So there's no scar around the belly button. And what the question was is, well, yeah, okay, I don't have very much skin, but I had big babies. These are really great six-pack muscles. Can you do the muscle repair working from down here? Yes. You can. You have to work around the belly button, and that's what makes it hard. Because the belly button and the stalk, if you can kind of imagine it, again, another great drawing. Let's see. It's still there, so there's a lot of like looking and craning my neck. But yes, the short answer is it can be done. Most women would do better with a full than a mini, especially if you've had children, because the mini tummy tuck, now this looks like a Freddy Krueger drawing. Hold on, let's try one more time. The mini tummy tuck cannot tighten anything above the belly button because the belly button is fixed. So if you could imagine, if I'm just taking skin here, it would be more straight in real life, and pulling it down, because this stalk is fixed, I can't get any amount of skin out of that top part. So if you have any looseness above the belly button, it's not the operation for you. Greta popularized it. Greta was a candidate, not to share all her medical history, but she shares it all the time. And we had a run of those, but for the most part, women qualify for regular tummy tucks. Tiara says, what do you recommend for lollipop scar lifts after 6 weeks? So I know I say this a lot, but I really do mean it, and I'm probably reaching different people every time. I don't think there's anything magical that you can put on your scar that penetrates through the skin and somehow fundamentally changes the scar. I think it's temperature and pressure. I think that whatever you put in, if you're massaging it in, you're creating friction, which is creating both temperature and pressure. I think that you want something that's essentially not going to aggravate your skin. And I think that you can also use a silicone strip because it's doing the same thing. It is providing a little bit of increased surface temperature and a little bit of pressure against the skin. You can buy that in the drugstore. They're not expensive. You can also be like me and just leave it the heck alone, and it'll fade out anyway because time is on our side here. If I don't see that I have any questions yet, which is fine, I just want to make sure it's working. Can you combine surgeries like chin lipo when you get a tummy tuck, and can you get a lipo on the hump some women get at the top of their back? Short answer is yes. Longer answer is chin liposuction, I wouldn't wake you up to do it, meaning if you're going to be asleep anyway and we're going to combine that procedure, I'm going to do it with you asleep. But if you were going to do it in isolation, like you were just thinking about having submental liposuction, it is definitely not something that you need to go to sleep for, and it's done with you awake. I think what you're talking about, Kelsey, is the buffalo hump back here. Sometimes it's called buffalo hump. It kind of depends on why it's there and to make sure that it's fat. So some people, especially older women, I see it at church a lot, which I don't know, maybe that's just the time I see older women. But I just kicked the camera again. It's part of my charm here. Okay. You know, they're hunched over because they have what's called kyphosis. They have collapsed cervical spine, the neck backbone, if that's a word, vertebra. And so they're hunched over. It's not fat, it's a bony thing. So she would not do well with liposuction. If you have HIV and you develop a buffalo hump, which they're not sure, it's probably the HIV, maybe it's the, gosh, I haven't thought about this in a long time. I can't remember what it's called. Anyway, I know it's like heart therapy, highly active antiretroviral therapy, the retrovirals, that's what I was saying. It might be a side effect of the protease inhibitors or the retrovirals. That fat doesn't really respond well to liposuction. Now there are people, sometimes they have PCOS, polycystic ovarian syndrome. Some people just have a fat pad back there. I've had reasonable success with those people. So not bony, not related to HIV, yes, you can liposuction it. You would have to be on your tummy to have that liposuction done, but that's fine. Okay, Lauren says, if you're getting a lift, the nipples always have to get moved. Any lift where they do not touch the nipples. And when you get a lift, does the implant tend to look bigger or smaller or stays the same size? Great question. The only lift that I can think of that doesn't cut around the nipple is what we sometimes call a smile mastopexy, but you wouldn't have it if you hadn't already had surgery. So what am I talking about? What I'm talking about is, let's say, oh buddy, the drawing is happening again. Well, this is a really bad outcome. Oh my God, hold on. I'm laughing at myself, how bad I am. Let's say that you look like one of these breasts. Not the best drawing in the world. But what I'm trying to illustrate is the nipple is too high. We would go in and take this part out at the bottom of the breast. Does that make sense, kind of? To shorten up the nipple to fold distance. So the nipple to the fold, or the nipple to the fold, depending upon what direction you're looking at. That almost never needs to happen unless you've had a lift already that's cut around the nipple. So the only way, what you're really doing when you do a lift is you're removing the nipple. You have to move it somehow. It doesn't move in isolation. I mean, theoretically, you would never do this, but like just to help you think about it, if you wanted to put a scar right on the front of the breast, I suppose you could, but I don't know why you would do it. So let's say you have a saggy nipple, okay? I guess, like theoretically, you could take a big wedge of skin out up top here and close that together so that you then had a big line, like a big scar here. And that would move the nipple up a little bit because you took out excess skin, but nobody would do that because you'd have a huge scar on the front of your breast. So you do better to just cut around the nipple and move it up. I hope that was helpful. And then your second question, when you get a lift, does the implant look bigger, smaller, or stay the same size? Obviously, it's literally staying the same size, but it's an interesting question that you bring up. Your breast will be smaller because you've taken out at least some skin, if not some skin and a little bit of breast tissue. But when we look to kind of judge how big or how round our breasts look, we're often looking at the ratio between the volume of the implant and the volume of the breast. And so by subtracting a little bit of the breast, it does make the breast, the overall shape look rounder because you've got now slightly more implant relative to breast tissue, if that makes sense. So I don't know if it makes your breast look bigger, but it certainly makes your breast look rounder to have a lift. Casey says, how do you know if somebody needs a tummy tuck or just liposuction? A lot of it is surgeon judgment, but I'll tell you the short answer is if you've had kids, you need a tummy tuck and not liposuction. Or said differently, even if you don't need a tummy tuck, you at least aren't a great candidate for liposuction alone. And then why is that? Well, and there'll be exceptions. I hate like always and never, but when you've had a pregnancy, you've got extra skin because you stretched it. You've got muscle separation, and sometimes we have excess fat. The liposuction only gets rid of excess fat. It doesn't do anything about tightening skin or tightening muscles. So if you've already got a little bit, sometimes you have a lot, sometimes you have a little bit. You've already got a little bit of loose skin. Now you're going to suction fat out of it. Now you have more loose skin because you have less volume in that skin. And then unfortunately, there's nothing that you can do exercise-wise to make that skin tighter. There's no exercise for your skin. You don't do 1,000 sit-ups and suddenly your skin is tight, right? In certain areas of the body, I think the glute, the buttock muscle, I think if you can make that muscle substantially larger, because it's a big, thick muscle at baseline, you can make that muscle substantially larger by doing squats or whatever you fit people do to make your butts look great. There's a lot of my patients who are doing like booty by Brett or something like that as a plug. I don't know, I've never done it. That's what I hear. That muscle's big enough to where you could potentially take up some of the loose skin of your buttock by making the butt bigger. Your rectus abdominis, your six-pack muscles are like that thick. And maybe if you do 1,000,000 sit-ups, they're that thick. But you're not going to be able to add volume enough by doing exercise to take up the loose skin, the laxity of the skin. You could gain weight, your skin wouldn't be as loose, but most people aren't looking for that to be their solution. Okay, let's see, what else do we have here? How long after tummy tuck are you bathing suit ready? That's a good question. Are there any sun protections or cautions to take with your healing belly button? Yes, great question. So, depends on how much you want to be bathing suit ready. Not the first 6 weeks because you have tape on your incisions, so you probably don't want that. In the kind of weeks following the 6-week mark, you're still swollen and numb, and you're breaking up with your compression garment, so probably it's 3 months before you really want to go put a bathing suit on. Like, you can do it earlier, but you'll be mad at me or mad at the process. Great question about the belly button, because as you know, we do everything in our power to keep that scar low and hiding in your bathing suit. So it won't be the transverse scar, the long tummy tuck scar that's showing. It'll be your belly button scar, and you don't want to get a lot of sun on that early on. We think about a year of being really good about sun protection. I know you want to wear a two-piece, that's why you had the surgery in the first place. So it's either wear like a black one-piece, or just be really diligent about putting sunscreen on it. So I did the latter. I went to the Virgin Islands after my tummy tuck, and it was the first time I put on a two-piece bathing suit in years, and it felt amazing. Patty says she's 18 pounds from her goal weight. Should she wait to do her consult for Aug and Lift, hoping for surgery in February or March? I don't think you need to, honestly. Most people, not everybody, most people's breasts don't change that much with 18 pounds. Some people do. Some people have that, but you'll kind of know if that's you. Like, if your breasts rapidly deflate or inflate when your weight changes, then maybe you should wait a little bit closer. But a lot of surgeons, I don't know about a lot of surgeons, many Amelia surgeons would want you to come on in to have your consult sooner rather than later because the schedule books out. And that can be frustrating. Like, you're determined you have your surgery in February or March, you all start your weight in January, you call, and it's like, how about August? And that's really frustrating. And we don't want that to be the case. That is not our goal. Our goal is to figure out a way to serve you guys better than that. Oh, and then just kind of to finish my thought, it's probably about 30 pounds that I think you might start to see, on average, a little bit more change than what you would like. And we might size up the implant a little bit more, for example. Now, if you guys are asking questions, they are not coming through on my, they're not coming through. I'm seeing that people are watching. Oh, no, okay, I said that. And then, of course, Facebook proves me wrong. All right, Michelle said, oh, gracious. Okay, hold on. Would you consider a donut lift? Why do surgeons not like these? What does it mean when they say the scar is likely to stretch out? Oh, we don't like it because you don't like it. I don't mind it. It takes no time at all to do it. The problem is you're going to be mad at me. We don't like it because it doesn't work. very well anyway. Like even in the textbooks, I think it says if you want to move the nipple 5 millimeters or less, this is a good choice. If I'm only moving it 5 millimeters, I just assume it not have a big scar on it and stay where it is. So the problem is there's no way to control the diameter of the areola. And so you're going to take a breast, okay, let's say that's a little bit saggy, and you're like, okay, I have an idea. I want to make the nipple sit up higher. So I do my cookie cutter around your current nipple and areola. I do my bigger circle, and then I use suture, and I bring these circles together. The drawing's getting worse as I can't see. And so you bring that together, and you purse string it together, and as long as the suture's holding the skin, it looks pretty good. Now, I will also say, it looks pretty good, but it don't look great, because you took this breast, right, that's the areola on it, and you cut off this part of it in this direction, and then you move this back. And so what you got is a flat breast, because you cut the top off of it. And then it stretches. So skin stretches, right? Like people have tummy tucks and then they get pregnant again. They'll make more skin. Like thank God that our bodies are designed to do that, but it doesn't work right. And so the donut lift doesn't have a way to control the diameter, so that's why we don't use it much. And hopefully I answered that. Sorry, I'm a little fired up there. Samara says, what type of implants do you recommend for small petite women? Whatever you want. I know that doesn't help you much. I have learned that looking natural or looking proportionate, it means different things to different people. So I recommend that you come in and use a Vectra, where we can show you different implant sizes on your body, and that you, or not just to me, but to anybody, and then that you bring in some goal pictures of things that you like. If you're obviously a member of Bustmob, there is Bustmob Goal Finder. Like you can search that, bustmob.goalfinder.com, I believe. It might be bustmob. Oh, never mind, I lied. It's bustmob.com/goalfinder. You can put in your height and weight, or just your height, and search for other people and see what you like. How often do I see the muscle repair fail? I had a popping sound a few weeks after my repair, a lot of pain. My surgeon isn't concerned. I still can't do ab workouts like I once could and fell a few centimeters of separation. Hard to know. I knock on wood, and I know it's going to happen. And if you're my patient, I just don't recognize your name, so hope it's not. I don't know that any of them have failed. So I would say it's pretty rare. I will also say that you can't overlap them. Like you can, like in the surgery, you could for a few minutes, but the second that you engage that muscle, it's going to pull right apart. So the best you can get is back together, and then there'll always be, if you had a full tummy tuck, your belly button comes out from the abdominal wall, so there'll always be a little space around the belly button because it allows the stalk to come through. So if you're pushing right exactly on your belly button, you might find that it's a little bit, a little space there. It will be very difficult to see it on a CT scan or an ultrasound, because when you're laying down flat, you don't really notice it. It's more like when you engage those muscles, can the surgeon feel a gap? Cindy says she's 8 weeks, what happened here? 8 weeks post-op tummy tuck, breast lift, and reduction. I know I will have swelling for up to a year. Pelvic hardness at times. Is that normal? Yes, because gravity is pulling everything down. Both breasts, closest to the armpit, still sore and swollen. Will massages help? They won't hurt. Time and massage seems like a good idea. Okay. Jackie says she's scheduled with Dr. Fred in St. Louis. I just basically want you to know how impressed I have been. They kept me informed. I feel so ridiculously comfortable. That's so awesome. Okay. Taylor says, how do I know what profile is best for me? Or is choosing the profile in the surgeon's hands? You know, I would like it to be in my hands. I'm happy to talk to you about it, but my preference is once you've picked volume, let me pick profile for you, and just let me fit it to your chest wall. Because a lot of people are confused about profile. I just want you to know, like, if you hold volume fixed, So a 300cc, a 300cc, a 300cc, low, moderate, high, or whatever the companies call that particular brand, extra high, extra full, mod plus, whatever it is. The difference is a few millimeters. Like, get out a ruler and look at a millimeter. Like, not gonna see that. And so I would rather you let me worry about that and you choose a volume, simply because it makes it easier. I am positive that the #1 way to make your breast look different is to change the volume. Your own anatomy is such a huge part of it, and then the volume of implant that you choose is such a huge part of it, and then other things like over, under the muscle, is it saline or silicone or a super firm gel or a soft gel or the profile, those things are fractions, small fractions compared to large numbers of amount of change. We can't change your anatomy, we all know that, and so then it's just, what size implant? Like, that is the biggest factor. And the rest of them, we can kind of nudge, you know, one way or the other. Okay, I'm looking. Tova wants to know, when are drains required for breast aug and or breast lift revision? So almost never for the primary aug. I don't know anybody that's using them. I should not say no one, but I don't think so. Revision breast aug, so, you know, again, like, I'm going to answer this one from my perspective, because I guess I could brainstorm and come up with some reasons why other people might. If it's a really, really bad capsular contracture where I took out the whole capsule, so that entire thing is a fresh, raw surface, you can make the argument that so is the primary aug, but that whole raw surface that's inflamed because you had capsular contracture, I sometimes like to put a drain in for that. If I put in stratus, which is a kind of gross ick factor here coming, it's pork. I don't know if it's not called pork, but it is. It's pig. It's pig based. Porcine, I think, is like the medical term. It takes me a minute. That is it's pork skin. So it's like a chicharrones that is treated in a way that there are no cells, and it's preserved. And they call it acellular, no cells, dermal skin matrix mesh. So it's a no cell skin mesh for whatever reason, and we could talk about that more if you have burning need to want to talk about it. I doubt it. It can help prevent capsular contracture. So I don't use it prophylactically because it's like 10 grand a piece. But I will use it for refractory, meaning it's come back before capsular contracture. It needs to heal right up against the skin without fluid getting between the mesh and the backside of the breast skin or breast or whatnot. So I'll use a drain for that because I can't have any fluid build up. I almost never use a drain. I can't remember the last time I used a drain for a reduction or breast lift. So when I'm thinking about a drain, I'm only thinking about it in the context of around an implant. If I think that it might need if it's going to be extra juicy, for lack of a better term. Oh, Amber, not your patient. Okay, woo, okay, because I want to take you seriously. I'm just laughing at myself. I wonder how to get your doctor to take you serious. I'll be honest, some doctors have personality disorders, and they have personality disorders and you can't change them. And it's no different, well, maybe it's a little bit more, but kind of, I think I heard in a talk or somewhere between 2 and 5% of the population are like psychopaths, basically. You can't change them. They have some kind of problem. So if your surgeon's in the 2 to 5% of that, you probably won't change them. Most, I'm still somewhat of an optimist. The other 95% may not have been having the best day when they talk to you. You never know. Like, always remember, in an interaction, you're only seeing that little blip of the interaction, and you don't always know kind of what the rest of that person's day looks like, or what kind of story that they heard, you know, versus what you tried to say. I'm not saying it's your fault. I mean, I'm just saying, like, we all want time. We all want the patients to give us time, because if we intervene too early, we're going to screw up something. But all the patients, and me as a patient, so it's not like you versus me, it's like, it's just a different role in the encounter. I wish I looked perfect yesterday. That's what I paid you for. I know, but I don't want to hurt you, is kind of the back and forth. One of my thoughts about your muscle repair is that as that suture strength weakens a little bit over time, because it always does. It's like the same reason, like I said before, you can get pregnant after you have a tummy tuck. You'll stretch it right back out. Well, how is that? Suture's permanent. Oh, the suture sits there, but the muscles will spread around it. So as that suture loosens up, you may not notice that as much. So I would agree, probably you want to wait a bit. Probably at least a year. Brittany says, is 6 weeks post-op of a breast aug too early to get CapCon? One breast is firmer than the other, and I do have a spitting stitch. Typically the suture on the skin stitch is far from the implant. Not always, but typically. So I doubt it was a suture abscess that somehow then created capsular contracture. Like, not super likely. Maybe. It's not too early, but it's the earliest that I see it. So it takes about 6 weeks to get a capsule. So I can say clearly at 2 weeks it's not capsular contracture, because you don't have a capsule. Like, I've gone back, not because I wanted to, but I've gone back every once in a blue moon on somebody before 6 weeks and there's nothing there. So it takes a while for that to form. And then not only is it going to form, but if it's capsular contracture, it's forming and getting strong. Probably early. More likely what it is that it's just a little asymmetry side to side, and it's early, and give it some time. Let's see here. Jennifer says, if I only have mild ptosis and I want a more defined upper pull, should I forego the breast lift and go with bigger implants? Probably not. Because remember I said it's your anatomy and then the implant. So, but then I know I'm being kind of confusing, and I'm not trying to be. When we do the breast lift and we cinch up the breast, and again, I don't know, we haven't met, it's just words, but typically that's going to reposition your tissue higher in a way that will help you like your outcome more than putting in a bigger implant. The bigger implant will do it, but it'll sit low. If your breast sits a little low, the implant will sit low, and then you won't feel as perky and round. So if your surgeon suggested a lift, I know it's extra money and I know it's extra scarring, and nobody wants it until they have it and then they love it. So it's a balance. Let's see here. Did you see my question? Spitting stitches. Oh, I don't know. I may not have seen it, Kaylee. I'm sorry. 4 weeks post-op from an anchor lift and an internal bra, but my body keeps rejecting and causing openings. It depends on what suture it is, and then how fast you're how much inflammation is there and how fast you're absorbing it. Over the course of my career, I've put in less and less sutures simply for that reason. When I was at the university, we used to laugh about vicryl toxicity, meaning like we would put in so many sutures that we were like, gosh, I hope these things aren't toxic because we put in so darn many. And now I put in less and less. I have less suture abscess, and I actually like the outcome better, but I don't know, it's kind of what we were trained to do. Okay, sorry, I'm trying to answer the question. Once they're kind of through the skin, if they're still there, you can pick them out with a tweezer or rub across them or a Q-tip. Sometimes they will lose their strength. It will heal. It usually doesn't leave much of a scar. Does the Amelia calculator give you the cost for the saline or silicone? That's a good question. We don't charge less for the saline implants. We don't want to encourage you to choose it because we don't think for most people it's the right choice. You can have it, but it won't be discounted. It'll be the same price as the base implant price. For us, we're using mostly Sientra 106s, and then we have a $500 upcharge for the 107. Megan Perez, if I travel from New York to you for lifts and implants, do you use dissolvable sutures or do I stay until you remove them? I only use absorbable sutures in the breast, so you would typically stay for 2 days after surgery and then go back home, and then we would do our visits, our follow-up visits virtually, where you send me a picture. We send you like instructions on how to take them kind of standardized, and then you send me a picture, and then we set up essentially FaceTime or Zoom. My sister is listening in with me and hoping to book a consultation with you. Do you take patients from Canada? Yes. I can think of a couple of Canadian patients. In fact, it was harder when COVID was more of an issue because there was the testing and et cetera, but I think all that's resolved. What are your thoughts about antibiotics and capsular contracture with dental work? I think it probably doesn't matter that you, let me back up. I don't think you need to take antibiotics when you have your teeth cleaned, simply because you have breast implants. I think that there are still some surgeons that recommend it, but I want you to know this all started because I told Jeremy Pyle, my partner, that we needed to start, why don't we give antibiotics when people go to the dentist? And he was like, are you crazy? And I was like, no, I want to know why we don't do it. And he was like, look it up, see if you can find a paper. I was shocked. I had kind of fallen into the same thing, like I thought that's what you did. And there isn't even good data that when you have a mechanical heart valve, which is what we think is the highest risk of what we call endocarditis, people can die from that if they get little infectious globs that land on their heart valves. There's not even any data that supports giving those patients antibiotics around dental work, so probably breast implants. Probably not great data for that either. And if I back up and think about why that must be, it's that we're showering our bloodstream with bacteria all the time. Every time we brush our teeth, every time we eat something and food goes through the GI tract, like there's some bacteria that are getting in the bloodstream. It's kind of part and parcel of being a human being and living kind of in some sort of homeostasis with bacteria. And most of the time, that's not causing capsular contracture, right? Like it's a super small fraction of women that develop this. And we think it's mediated by bacteria, but we don't have great evidence for that either. So you're probably you're probably more likely to have some sort of terrible allergic reaction to the antibiotic than you are to prevent capsular contracture, if you can like work with me on that. So I became a convert to no antibiotics. Leah says, can you describe auto-augmentation? Is it included with a breast lift? So it is included with a breast lift, but if we're going to put an implant in with a lift, it's not included because I don't have anywhere to stick that piece of breast tissue. It's not like not included, it just isn't done. I'll try to describe it, but again, I'm always amazed by my inability to draw stuff. The problem is when I draw it, if I want it to all be on one thing, this lady doesn't need a breast lift, but work with it. Auto-augmentation means, so I'm going to draw this on you the day of surgery. The nipple is going to move up to there. These little edges are going to come together, and then this is going to be the new nipple position, the new areolar position. And then the tissue that's within this area, this now looks like a bumblebee to me. The bumblebee part down here, the stripe part, I can either throw that kind of triangle away or I can keep it. When I do a lift alone without an implant, I usually keep it because I think it may help a little bit. So I divide the blood supply. So the nipple's blood supply is now coming from the top of the breast. The blood supply to this striped thing is coming from the bottom of the breast. And I'm going to take it and tuck it up underneath. So you don't see it from the outside, but from the inside, you would, well, it might be here. It's tucked up underneath the breast when I do the lift, if you can kind of imagine it. And then, I thought I did a reasonably good job drawing this for a patient yesterday. I'll try to draw it for you. If you have a lift without the auto-augmentation, where you throw that away, and this is just a drawing, but this might be without that, keeping that stuff, and that might be with keeping that stuff at the bottom. If you are hoping to look like this after, then we need an implant. Like this dotted line is an implant. Like your natural tissue won't sit up like that without an implant. It'll do it with a bra, but not when you're naked. So I do think that it can help the shape of the breast lift to do the auto-augmentation. And I do it more often than not. 5 weeks post-op, do they still need to drop? Yes, ma'am. Corey says, how long does the muscle repair pain from a tummy tuck last? I was feeling better. Within the last week, my right side started hurting again with a burning sensation and like I'm ripping apart. So you won't rip apart. The burning sensation sounds like a nerve pain. I don't know exactly how long it'll last. It's different for everybody. I am a softie to prescribe gabapentin to any of my patients that have any burning pain at all, because I think it has very low risk and very high success rate in making your pain better. So you may want to ask your surgeon about that. Oh, 10 weeks post-op. Yep. Let's see here. No implant. Okay, I'm reading. Emma says, when can you think I can start going to the gym? F45, I'm 5 weeks. I don't know what F45 means. We tell our patients about 6 weeks, no more restrictions from any muscle work. Surely hate. Zoe said, I went to the dentist today. I didn't realize it was a no-no. It's not a no-no. Go get your teeth cleaned. That's very American of you. Keep it up. Marissa says, when does the nipple sensation come back and when do they drop? So everybody's a little different. I think that being a slightly numb takes longer to resolve than if you were slightly hypersensitive. For whatever reason, I think it takes the nerves a little bit longer to get back online. I had a numb spot that didn't get better on my breast for 2 years, and I was sure it wasn't coming back. And one day I went to tell a patient, I have a numb spot, and then I was like, wait, I don't have a numb spot anymore. So it could take a long time. What I was trained to tell patients was a year, but then I had an experience that it actually took more time than that. If you have no sensation, like you could burn it with a lighter, that is less likely to come back than if it's just a little different, like not quite as much. So I know this sounds really ridiculous, but like very lightly or with a Q-tip, like touch your nipple and don't look. Just don't watch yourself touch it and see if you feel it at all. If you feel it at all, it'll almost certainly come back. Holly says, I had a PE following a C-section. Would that prevent me from getting a breast aug? No, not necessarily. We do a risk calculator for everyone, and if you get a whole lot of points on it, and you'll get our particular scale, you get a bunch of points for having had a personal history of blood clots. We might refer you to our vascular surgeon and then just see what he thought about if you need to be on blood thinners, when to start them and stop them around the time of surgery. If you do need blood thinners, you're going to be at a little bit of a higher risk of having bleeding. It's just a balance, but we do that all the time. What holds the implant in place when it's over the muscle? The breast tissue, the fold, your natural connective tissue. Thank you, Sherry, for the love. How long, May says, how long would it take for butt fat graft to settle? Would workout impact fat graft? Yeah, I think so. It probably does. So I wouldn't want you to sit or put any pressure on that graft for 2 or 3 weeks after surgery. And so if you sit on it, the reason I don't want you to do that is I don't want the blood supply to be impacted and it's swollen and it's sore, etc. I don't think after 3-ish weeks that it matters if you work out or not. Like, I think you should work out. It'll make you feel better. I've never been out to sleep with anesthesia. Is it safe? Well, I think you got to look at where you're going. I would be a lot more worried about being in a different country, or because I wouldn't know what the accreditation of the facility was. I'd be worried if I was in a strip mall in an unaccredited facility. And so I think the questions that you want to ask are, is this an accredited surgical center? Because if it is, like, there are a million hoops that we have to jump through to get it accredited. And there are a few accrediting bodies. One is called JCAHO. It's GCAHO. That's generally hospital type accreditation. There's Quad ASF, which is like American something surgical facility. And then there's American Orthopedic. It's like AOA or something like that. And so if they're an accredited surgical center, you should not be afraid. If you're otherwise healthy, they're going to take excellent care of you. And we have every rescue, drug, crash cart thing. If God forbid something totally unforeseen happened to you, those surgical facilities have to be prepared to manage that. How long does the pain continue with lying on your back to sleep with a breast augmentation? everybody's different. I think you can go pretty quickly to your side if you feel comfortable on your side. I don't think you'll hurt anything. Holly says she's thinking of coming here. You certainly can. You can also look at Dr. Paul's practice in Fort Mill. I don't know exactly where in Charlotte you live, but that's just kind of South Charlotte, essentially, even though it's South Carolina. If you still have 20 to 30 pounds to lose, should you do a tummy tuck or a mummy makeover? I think probably more than 30, lose it, especially if you're going to stay at that weight. Don't starve yourself right before the surgery, though. That doesn't make any sense, because then you're just going to gain it back, and it's not going to change anything other than you were miserable during the starving yourself part. Going back to the 20 or 30 pounds, I think if you're going to lose 30, 40, 50 pounds, I might be able to get you a little bit tighter if you'll go ahead and lose that. And I think it'll make your recovery a little bit better, like you'll weigh less, you'll just have a little bit more energy, etc. Jane said, I had my surgery yesterday. According to my Vectra, my right side was 2 cc's bigger than my left side, but my implant card says that I got 305 on my right and 285 on my left. Why would this be? Well, hopefully your surgeon talked to you about the sizes and you agreed on it before you went to sleep. I don't think the Vectra is perfect, right? And nothing's really perfect. My guess is that your surgeon felt like one breast was bigger than the other one and put the smaller implant on the bigger breast, trying to balance it out. And truly, the difference in 285 and 305 is 20 cc's. I think I have a 20. This is 20 cc. Sientra provided me with this. Like, it is nothing. So I don't think it's a big deal. And when I went to, I wanted to know if the Vectra could simulate my lift, because I had my implants put in and then I had another kid and then my boobs fell off my implant. It was all sad. So then I had a lift when I had my tummy tuck. And I kept, every time I did the Vectra, I got a different volume of my breast. So I'm not sure it's the world's most reliable for volume, right? It's just a photograph in time, and it's trying to make a lot of assumptions. Sarah says she's having surgery with Dr. Paul. He's wonderful, awesome. Suni says, as far as capsular contraction, any suggestions to help not get it? Well, the things that we know, if you've had it before, you're more likely to get it. Putting your implant under the muscle is 6 to 10 times the risk of capsular contracture than over the muscle, so put it under the muscle is another suggestion. If it's a breast aug alone, the crease incision is a better choice than around the nipple or under the arm for capsular contraction. And then the surgeon, there's some surgeon factors like use a Keller funnel, use betadine, keep the nipples covered with Tegaderm, like medical grade saran wrap during the surgery, that can all decrease your risk. That's about it. Unfortunately, I don't know anything post-operatively that you can do to change your risk. Petra says, if I had a prior tummy tuck, had one more baby, and now want a full, will the mini prevent me from getting good results, especially with my belly button? Maybe is the short answer. And we'd have to, so ideally we'd want to know what happened to your belly button. Sometimes, and I didn't mention this at the beginning, sometimes the surgeons do what's called float the belly button. So they leave it connected to the skin, but they cut the stalk, and then they pull the whole thing down, and then they try to secure the belly button back down to the fascia. Unless your belly button is real high to start with, it looks strange, because you're supposed to, like when you look at a normal person, there's a certain distance that looks normal between the belly button and the hair-bearing skin, and so if your belly button is next to the hair-bearing skin, it doesn't look quite right. And so if they've already cut the blood supply to the stalk and the belly button's in a weird spot, you might kill it if you cut around it, because the only blood supply is from the skin around it. So the first thing I'd wonder is what's going on with the belly button, and I know you wanted to ask about that. And they probably would get that from the surgeon's op note. The second thing is, would the mini prevent me from getting, well, you've already had some skin taken off, and so it can, if you didn't stretch out a whole lot with that next pregnancy, it might be tough to get out all the skin from the belly button down to your previous scar. So it can make it more challenging. I have done fulls after minis on women that have had multiple pregnancies, or any pregnancy after that. Or just they don't like their result because they should have had a full to begin with is another reason. Could high profile implants have the same projection as mod profile? I'm afraid of high profile having too much projection on me. They can, but not the same volume. They can have the same projection in different volumes. So remember, projection is this way. So very rarely, at least for me, am I in the mirror like, ooh, they go out a little far, not enough like that. Most women aren't doing that. What they're looking more at the shape. And I think the reason why the myth of high projection implants are up here is because they're often used with higher volume. So if the volume is 700, you're only so wide, like bony ways, so it has to go out this way because there's nowhere else for it to go. And so if I were to look at my handy dandy like Sientra order form, let's say 5 centimeters is your desired projection, if that was something that mattered to you. That would be 415 cc's in high projection, or 525 in Mod Plus, or you can't even get that in moderate projection in Sientra. If you went to extra high and you wanted 5 centimeters, you would be less than 275. So projection isn't, I don't think I would search my implants based on how much I wanted them to go out, because it totally depends. I'm not sure. I think I overcomplicated that answer. Sorry. What is stable weight after weight loss surgery? I'm 14 months out with 125 pound loss. So A, congratulations. I'm sure that changed your life. B, typically probably no more than 10 or 15 pounds for about 6 months. Benna, when does the boob pain stop at night? They just feel achy 5 weeks out. Everybody's different. I know I'm being a pain by saying that, but I can't give you a number because then you'll be mad at me when the number's wrong. Jane says, if I have intermittent nipple inversion, will implants help that, or do I need to do something else about it? Implants will help it, especially if your nipple comes out, because it's going to put it more on stretch. But if you're done having kids, I'm happy to release its ducts that are holding the nipple back, and so like I literally just go in there and snip them. But if you want to breastfeed, don't have them snipped. Wait till you're done with that. Okay, normal. It is normal, yes. Okay, hang on. I think I have a few that were written in. I want to make sure I get to those, and then we're going to call it. We talked about that. We talked about, okay. Bree said, do I encourage the use of underwire bras to help prevent implants from dropping too low? No. If that worked, none of us would, most of us wear underwire. Before I had my surgery, I wore underwire all the time. My breast still dropped. So I don't think it really matters. Marissa says, I'm year 9 with my second implants. I like my shape. I just want a bit higher and not going bigger, maybe even smaller. Should I do a lift in implants? Yeah, you can totally do that. A lot of people do that. My mom is actually getting ready to do that, which I'm kind of excited for her. Hey, Mom. When can I stop wearing sports bras and when can I start lifting? That's Brandy's question. I'm not sure what your surgeon recommends. I don't really care what bra you wear, as long as you don't, if you have a crease incision, I don't want you wearing an underwire bra for 6 weeks because I'm afraid you'll rub your incision and not realize it. So if you're more than 6 weeks out, I think you can wear whatever bra you want. And as far as lifting, 6 weeks, you can get back to it. It's going to feel a little different if you have implants under the muscle, but you're not going to hurt anything. 9 months post-op, Courtney says, with unders, love my results, but my right side is still higher and seems like the muscle won't let go to let it drop into place. At what point should I be concerned that it won't drop? He said after surgery I had very strong pecs. Well, congratulations. I don't know. I know that's not the answer you want to hear. I would go back and see if there was pre-existing asymmetry, because if there is, it's just, it may always be there, or it may take longer for it to kind of drop. Every once in a blue moon, we'll go back and adjust that pocket lower. I have a patient that I'm getting ready to do that on who's always asking me questions, and I love her, and she has to travel to come and see me. It's rare, but what I would recommend is that you do serial photographs every month to 3 months, and then look and see if it's changing. And if it's not changing anymore, it's time to intervene. But probably no sooner than a year from surgery. I know nobody wants to hear that, but I'm telling you, no matter how mad you are at your result, you'll be madder if it's worse. And we can always do that. We can always make you worse, even though that's never the intention. Leading up to surgery for a breast aug, do I suggest not working out? Oh no, go ahead and work out. There's no reason not to. Tammy says 3 weeks post-op, right side feels like the muscle's stuck on a spasm. It's been painful since I woke up in recovery. Probably it's stretching. It's probably like really stretching pec back and up and over because it's mad. Somebody just cut it and shoved an implant under it, so it doesn't feel great, and then it wants to contract. You want to take the tension off of it, but then now this makes your trap hurt. So there's a little bit of stretching. You know, sometimes I think about hematoma when I have one side that's more painful than the other side, but the story's almost always the same. Acute onset of swelling and pain. Acute onset, so, oh my God, and then it's not subtle. So it's not a little bit worse than the other side. It's like real bad. Stephanie says, how do I deal with patients that are afraid of large CC numbers? I can't get over the number myself. I don't know. I tell them to talk to other people. That it's not a big deal. I have a medical assistant who's wonderful. She's a delight. She's Emily, if you've met her. And she has pretty sizable implants on a pretty small body. So sometimes we get Emily to come in and be like, okay, here's this. Like, it's just not, like, whatever we're seeing, whatever we're coming across online that look like, you know, balloons or something, like some, like, just, like, that's not a silicone implant. That's not an on-label use of an implant. That is an overfilled saline implant that looks, it's a special look. Some people want it, some people don't. Megan says working out the muscles of her chest. Yeah, I don't think you can hurt anything by working out the chest muscles before the surgery. Like, go ahead and work them out, because I'm going to ask you to stop for 6 weeks. So it doesn't matter to me if you have if you work out a lot before your breast aug. No big deal. Major difference in Allergan and Mentor Boost. So I'm going to claim a little bit of ignorance here, and I'm sorry. I think Mentor Boost is the new gummy bear Mentor implant. And so in order to be called that, I think they have to have some level of cohesivity of the gel, like how firm the gel is, how much of a solid is it like. But I'm not a chemist, and so I'm like, oh, I don't know. Like, they show me pictures under an electron microscope, and I'm like, I don't know. And so ultimately I think what I can tell you, like on my kind of 5'7" surgeon view of it is, in general, Mentor does not have an included warranty. So you would have to purchase the warranty separately. So I don't like that. The second issue that I have is that the rupture rate, now these studies are not powered, they don't have enough women in it to directly compare one to the other, but the published rupture rate at 10 years for Mentor was 20%. Versus Sientra at 9% and Allergan, I think, at like 11. So can I say for sure that the rupture rate is higher in Mentor implants than in Sientra and Allergan? No. Does it make me worry about it a little bit? Yeah. All things being equal, would I choose Mentor? No, because they don't have a warranty and their rupture rate makes me a little nervous. I have Mentor implants. So, you know, years ago when I had implants put in, I just wanted my friend to put them in. Like, I knew that he did thousands of breast augs a year, and I just wanted to be another breast aug. Like, I didn't want anybody at the university who's not doing a lot of them do it for me. I didn't want to have surgery where I worked, like where people knew me. I just wanted to go away, have my implants, and come back happy. So I was lucky to have a friend do it, and I wasn't going to ask him to use a brand that he didn't normally use, right? I just wanted the regular thing. So I'm perfectly happy with my implants. I like them very much. But all things weren't equal. Right, like if he had used all the implant manufacturers, I would have chosen it. Anyway, that was a long live. I hope it was helpful. I hope you guys are having a great day, and we'll talk soon. Bye.